So a question that I get commonly asked is, am I a good candidate for a knee replacement? Well, to begin, you have to know what a knee replacement is for. Not everyone who has a problem with their knee is a good candidate for a knee replacement. So knee replacements are primarily designed for people who suffer from osteoarthritis or rheumatoid arthritis or some kind of damage to the joint. So there's lots of reasons why you can have, quote, a painful knee. But what a knee replacement is designed for is where the cartilage, which is that soft covering around the bones of your knee that lets you glide and slide as you move your knee around, when that gets damaged to the point that it's no longer functional. Now, the number one symptom obviously is going to be pain. A knee replacement is a great option to get you back in the game and playing and living life to your fullest. How do I know if I need a knee replacement? Well, the first thing you have to do is have the right diagnosis. So you have to figure out, why does your knee hurt? So the first step would be, well, come and see us here at Marshfield Clinic in our orthopedic department, and we'll probably start with getting an x-ray of your knee. So we try, number one, is to establish a diagnosis. Number two, try to exhaust conservative treatment options. And if that isn't the case, then we can discuss knee replacement surgery for you as a treatment of your knee pain. Now, the most fun question I get asked is, what exactly is a knee replacement and how do you do it? So a knee replacement is a surgical procedure in which we go inside the knee joint itself all the way down to the bone. Arthritis is a condition where the bone is affected, and most specifically, it's the coverings of the bone, which we call cartilage. So when the cartilage is damaged beyond the point of salvage, well, then we can remove the cartilage and place in metal parts. So a little bit more information on that is quite simply, if we open up the knee joint and are planning on a knee replacement, we do have to take a saw and remove some of your bone. I know that can be very scary, but we have the technology today to do it in an efficient and safe manner with good anesthesia, robotics to minimize the amount of damage we have to do, to where we can replace your knee through a surgical procedure where we open up the knee, remove the bad parts of the bone, and resurface them with metal parts. And then between those metal parts is a plastic bushing. So it's very similar to how a car would operate with a new ball joint or something like that. It's a procedure in which the ends of the bone are removed and replaced with metal parts and plastic bushings in between them to get rid of the arthritis. So a knee replacement is a surgical procedure that cures arthritis by removing it off your bones.